Welcome to the Soul of Medicine. Hello, welcome to the Soul of Medicine podcast. I'm Dr. K. Corpus.
And I'm functional medicine pharmacist Robert Kress.
We'll be hosting this podcast featuring holistic healers and teachers from around the globe. They are seasoned, cutting-edge practitioners who embody the wounded healer archetype. Out of necessity, they've learned to attune to their truest soul desires by often going against the grain, heal their wounds, and turn it into a gift which they now offer to the world. We will all benefit from their wisdom and example of how to move forward through life with knowledge, attunement, wellness, and grace. In this podcast series, we'd like to focus on wellness versus illness, how to heal from the inside out, removing mindset and energy blocks so that the physical body can function optimally. Some of our upcoming podcasts include our approach to functional medicine, integrative cancer care, myofascial release for trauma, the healing power of intuition, and featuring practitioners in somatic experiencing, compassionate inquiry, functional movement, energy medicine, women's health, and so much more. Welcome to our intro podcast at Soul of Medicine, where we thought it would be fun to have a listen to our signature talk on the foundations of functional medicine. At Soul of Medicine, our functional medicine approach focuses on a holistic model of the body-mind. We look for a root cause to symptoms and disease and treat the whole person. Physiologically, we focus on the triad of sex hormones, adrenals, and thyroid, as well as gut health as the foundations that influence all other organ systems that can cause downstream pathology if not balanced and working in harmony.
I am honored to introduce you to Dr. K. Corpus, MD, a family physician, fellowship trained by Andrew Weil, MD, at the Arizona Center of Integrative Medicine and the Institute of Functional Medicine. She is also a certified Whole Health Medicine Institute lifestyle coach. She is the founder of the Soul of Medicine, a holistic clinical practice serving patients in Kentucky and virtually nationwide. She is a 500-hour experienced registered yoga teacher and owns The Loft, a yoga and movement studio in Owensboro, having led international retreats and teacher training programs. Kay is also mom to two rad teens, Bella and Luca, and a toy poodle named Obi.
I'm honored to introduce Rob Kress, a pharmacist and functional medicine specialist at the Soul of Medicine. Rob took his passion for a holistic approach to health and became board certified in clinical nutrition, the art of pharmaceutical compounding, primal health coaching, yoga teacher training, and is also a MoveNat Level 2 trainer. Rob leads our men's health program and consults with patients with K. Corpus, MD, and educates other medical practitioners on functional medicine. Rob was recently named one of the top 50 pharmacists in the U.S. He lectures, writes, and podcasts regularly on the topic of lifestyle and integrative medicine and is dog dad to his amazing mini Aussie, Pilar.
Welcome, everyone. Thanks for coming in. So we're going to talk a bit about foundations of functional medicine, kind of our take on the dynamics of it and how we approach it. We generally find our way into our functional medicine via our own stories. And Kay and I had this interest in way before we even knew each other. We were studying the same, we were reading the same weird books. And suddenly when we kind of met, it's like, we're up there. This is kind of cool. I'm a pharmacist, Kay's a medical doctor. And we kind of approached it with our unique nuances, but also our very similar approaches.
Yeah. And I think the best way to learn, well, for me anyway, functional and integrative medicine is to be the patient. So I remember being that stressed out human, really hit in medical school. I remember, sleepless nights, studying all the time, found yoga in medical school. The best part of yoga was, like the sleeping part at the end, the shavasana. Like, this is fabulous. Don't remember last time my brain calmed down. And then going into family medicine, I'm traditionally trained in Western conventional medicine, but had this interest always of holistic medicine, studied with Andrew Weil at University of Arizona and kind of did both. So for a while, it was like integrative functional medicine in the closet as I was doing regular medicine, And I did read this book. I don't know if you guys know Carolyn Mays. She is one of my favorite authors. She's like an awesome spiritual teacher. But I remember her writing that all disease is caused from an emotional imbalance. I'm like, well, why the hell am I studying this stuff then if it's all an emotional imbalance, right? But that was kind of my dip into something deeper past the physical body and really looking at the body as a whole. And so, doing our own work, my own work through residency after that, just you kind of have to hit the wall to be able to figure out, what all stuff is. I have a whole shelf in my office. It's actually like one of those baker's racks, and it's like full of supplements. And I tell my patients, I know that because I took all of it, and you kind of burn out after a while and you just kind of learn the supplements to be able to wake up, sleep, to eat, to poop, to just function. And so, of course, you kind of look at every possible way to heal. So every modality that there was, I did it, took it, tried it. So did you, right? And here we are. So a lot of the way that we practice is from personal experience, which became then clinical experience. And now we're, seeing it in most of our patients. So I think that's kind of the missing piece in medicine, is that to understand that we're all going through the same thing. I think the basic premise is that we sometimes feel that our bodies are out of control. It doesn't matter if you have diabetes, autoimmune disorder, GI disorder, cancer, et cetera. It's like we don't know what's going on. We're confused. We're not told everything. We don't understand the way the body works. And I think both of us are in hot pursuit of always like the why. Tell me why. What's the root of this? Because there's a lot of band-aiding that goes on, even with natural supplements and modalities, by the way. So it's really understanding the way the body works, which will teach you. And that has become the foundation of our practice. And we do understand that it's more than physical. Part of the pie, a lot of the pie is our emotional being, our psychological being, our spirit. These are things that, we don't talk about. We can't talk about that in a doctor's office, particularly in 15 minutes, So therefore, we don't practice like that. We spend a long time with our patients to get to know them. And we just try to put the whole story together. So hence, physician, pharmacist, we call our practice soul of medicine because it's science and the soul, right? And it all matters.
And it's really interesting to come from a pharmacy point of view. You've got one that can attest kind of, you've got a little bit of anti-pharmacist in you. So, makes you ask questions, and, same thing. It's like anti-conventional because you're fed one way and you're seeing things that are working, right? We're patching side effects with more medications. That's not the approach. So,
And I think what's important here is the contrast, right? Because you had to be in one system to know what you didn't want, to be able to go into something and to what you do want, right? So we've all experienced, maybe the system in a certain way wasn't what we wanted, didn't get, maybe sometimes or it was like an acute situation or trauma or something like that, we're not knocking the system at all. It has its place. However, for the majority of what we're talking about is chronic stuff, like things that are persistent, recurrent.
So we'd like to do a comparison of traditional Western medicine with more of a functional integrative approach. So you'll see in the Western medicine, there's a focus on the physical body and symptoms. With traditional Western, the patient is a passive recipient of care, right? Primary care says this is what you do, you listen, you follow along, you follow that way. But more in a functional integrative, there's an emphasis on bringing the patient in as a co-creator. So they have a say. And we have a lot of conversations about that. Patient is not expected to make significant lifestyle changes in Western medicine. Functional integrative, we're often asking people to make some significant changes. That could be with diet, it could be with lifestyle, it could be with creating boundaries in their life. There's a lot of things that influence our state of well-being and our health that are kind of bypassed, right, in the traditional or the Western medicine. There's a co-creation, as I mentioned, and I really love the last one here. Patient's home, community environment, typically not considered.
So we say it's more about not what you eat, but who you eat with. I love this quote by Rumi. This is primarily how we look at the body from a 30 or the being, you, from the 30,000 foot perspective, right? And what happens in the body is the caboose. It's not the cause. I'm talking about the physical body, the physical manifestation. And so we spend a lot of time in medicine fixing the physical manifestation of the things that are the true root cause. So I love this quote by Rumi, where he says, the wound is where the light enters you, meaning it's the pain is the portal in to something else. However, we just want to get rid of the pain, give me something for the pain, make the pain go away. I don't want the pain, right? And that's where we tend to patch things up and Band-Aid when we're really not looking at the true root cause. A person's health is not generally a reflection of genes, but how their environment is influencing them. Genes are the direct cause of less than 1% of diseases. 99% is how we respond to the world. This is epigenetics. Epi meaning beyond genetics. So we hear a lot of patients, my mom had thyroid disorder, my dad had diabetes, therefore I will. So not true. Dr. Gabor-Mate, he is a now retired Canadian family physician who worked a lot in trauma and addiction. His latest book out is called The Myth of Normal. Very awesome. A lot of the research is in that book between emotions and the physical body. And what he says is if I chronically repress my emotional needs in order to make myself acceptable to others, I increase my risk of having to pay the price in the form of illness. And in his book, and I mean, he's got podcasts everywhere if you want to check him out, but autoimmune disorder is really about suppression of healthy rage and people pleasing. Yeah, that's pretty interesting. Yeah. So your biography becomes your biology. So your story of your life gets registered in your cells and tissues. And this biography includes the totality of your choices, the things you feed your body, your thoughts, your actions, your food, the things that feed your life. So every negative event that's ever happened gets registered in your cells and tissues until it is healed and integrated, right? And that becomes the pathology. So a lot of times I think, if somebody came in with heart disease or a neurologic disorder or in the gut, to me, it's like tension. There's two opposing forces that are going against each other, causing tension in that particular area of the body, right? And so what's the tension? Usually something that is wanting to be expressed, coming out, and then there's another force of usually is the forebrain telling you, I wouldn't say that, I wouldn't do that. Who do you think you are for doing that, right? So it's usually socialization and programming that keeps the authentic voice and the authentic way of being down. And eventually when the body gets weaker, I would say, as we get older, and for women, perimenopausally, when we don't have those hormones, or for men, andropause, we don't have all those normal raging hormones to push past that, is when we start to feel these kinds of things. Service.
This is us. So if you look at our biology, it's a combination of our psychological, emotional feelings, social, how we engage with others. One of the main root causes of disease is actually isolation, and we learned that for the isolation that we're on. Energetic, this could be relationships, this could be the environment that you're in. It could be very simple to how your home environment is. And then spiritual, whatever that might mean to you. With everyone else, people, it means different things, but there is this connection of feeling.
So when a patient comes to us, we want to know the whole story. We use a couple of tools to gather this information. It is part of, functional medicine tools, if you will. One is the timeline tool, the other is the matrix.
Yeah, so this is exactly showing how your biography can be your biology. So what it does is it tracks things through your years, what went on. So these are things that we really need to keep focused on. Why are you sitting in front of us, right? What are your chief complaints? What are your diagnoses? And what are your goals, right? And what are your possibilities? Sometimes people don't see that actually until we, get back and so we look at things and see how they influence where we are today.
The other way that I use this is to look at patterns in people. I believe this patient, probably she's 40, not quite 40 yet, but you see that there was, when she was younger, she had a few things going on in her 20s, hormonal issues, and then notice there may have been something going on early in her teen years, but then these are kind of the social triggers probably that broke the camel's back, if you will. And then look how it started to manifest. This was like kind of the reason why she came to see us, but there was like recurrent kinds of traumas going in her life. And it finally, came in. She was multiple surgeries, just trying to recover from that, a lot of adrenal issues. But so it's rarely, we get a lot of histories where it's like, oh, it's just that one thing. I got COVID, or I got that one thing, or I took that supplement. Somebody told me I ate that chocolate, 3 pounds of that chocolate that still exists today from 2014. So I wasn't able to digest it, and it just messed up my system forever. I'm like, wow, that's some strong chocolate. Maybe, but there was a backstory here that kind of was brewing, maybe weakening along the time. And then it's the straw that broke the camel's back. So you have to look beyond. I'm always asking what happened 2 years before that, 5 years before that, 10 years before that. And it's interesting, like cancers, for instance, typically there's some massive like rage situation a year or 2 years before that diagnosis. Also, what's really interesting with physical traumas or accidents, when people get hurt, it is like, what is the thought right before that happened? It's really interesting. Before your back went out, before you slipped on the ice.
What's interesting, the body's incredible because the body keeps us rolling with endorphins. The body wants us to feel safe. And when we finally feel like we're in that state of feeling safe, kind of let's go. And that's when things often happen. It's like our guard's down. On one level, we feel everything's fine, but it's all these physical modalities that finally build up, and that's that point.
We get a lot of that, like post-retirement, or like, you don't have, or got out of a job or something, or moved cross country, and they're so like symptoms are starting to show up because they actually have the time to feel. Because prior to that, they were running from a tiger, and that's a very anesthetic process. When you're running on adrenaline, you don't feel it, you don't care, you're just trying to get out of danger. And when there becomes a little bit of space, and you're not, super anxious, or your heart rate's not up, people are like, well, I'm just at peace. I know you're just so tired that if a tiger were chasing you, you would want the tiger to just eat you, because it's just easier. Just because you're not feeling anxious and hyper in that way doesn't mean that your nervous system isn't still activated. And it's fight, flight, freeze mode. Freeze mode is like, y'all, that's stage 3. You're kind of in resignation mode right there. That is not peace. There's a difference between peace and like, and yeah, that, and just like that catatonia, if you will. Yeah. Cool. Next, after our assessment, or our history taking, we go further into the physical body. So though we talk a lot about spiritual stuff and all those like ethereal kinds of things, the tangibility of the body is where we live. So it's not like this is not important. I was just talking to somebody the other day about Maslow's hierarchy of need. Like, it's great to like find your purpose and self-actualization. But if you are not pooping and sleeping and eating and digestion, I'm sorry, like That's the last thing you're going to think about. I mean, I remember this as a new attending. I would love to talk about life purpose. And my patients were like, after an hour and a half, they're like, can I get this Xanax? Or something for pain right now? Because I mean, that's like really great, but I'm hurting. Like, oh crap, sorry. Yeah. So it's important. And this is important because I think this is missed a lot in conventional medicine, is that if the hormones are off, then it's just the hormones are off. Or if it's just the thyroid that's off, then that's just primarily a thyroid problem. But this operates in the triad. So you could have, sometimes I see a lot of thyroid sex hormones off, like in women, there's like endometriosis, or they have PCOS, or they had to have a surgical hysterectomy, something like that. And then their thyroid was off, but they're always chasing hormones or thyroid levels every month and really are on max doses and still don't feel well. It's because they miss the adrenals. And hands down, this is the one that's missed all the time, even in other functional and integrative. And I don't know why, because you listen to the story. Well, I was stressed all my life. Well, stress, and it will show you, is the cortisol. Is the stress hormone is cortisol, which runs and pushes these other pathways. So for us, most of the time, the root cause is often the adrenals. And that thyroid gut connection, we see a lot of hypothyroidism. 90% of hypothyroidism is actually autoimmune. So if you're only giving Synthroid, which is only T4, and you're not addressing all autoimmune disorders, by the way, are in the gut. They start in the gut. So if you're not addressing gut with an autoimmune disorder and you're only throwing a thyroid hormone on it, it's not going to work. So let's talk about the adrenals. They live above the kidneys. They're triangular sort of organ. And it's kind of the organ that keeps on keeping on and to endure. Doesn't matter if I'm tired, doesn't matter if I'm hungry, just go, do better, harder, faster. But if you think about it, the adrenals secrete cortisol and DHEA, and every single one of these systems can be affected. So we get this a lot. I work out. I don't eat anything, and I just can't get the weight off. I intermittent fast, and it's all right here. Well, if you're running that cortisol pathway, it's going to stimulate glucose to secrete insulin, which is a fat store, right? And if your body thinks it's dying or going to die, it's going to hold on to weight, not lose it, right? Very typical. We get this all the time. So you have to rest to digest, meaning in your head. If you are not resting, you are not digesting. So that will actually cut the acid, particularly betaine hydrochloric acid, to your stomach, which then could cause achlorhydria, no stomach acid, or hypochlorhydria, low stomach acid, which then can cause reflux, not high acid that causes reflux. It is low acid. Then when we see across the board B12, iron, thyroid, D deficiencies, you're looking at the whole panel. That's an automatic hypochlorhydria or achlorhydria, or a vitamin D that's super low that won't come up and you need massive dose. This is a digestive issue. It's not because we live in Kentucky and it rains all the time, or Seattle or whatever. There's all kinds of things, but that's a digestive issue, automatic. So if your food sits there, it can rot and ferment, causing bloating, fullness, belching, and then the off-gassing of the bacteria, small intestinal bowel overgrowth, candida overgrowth. Then finally, maybe it goes down your system and then causes inflammation in the guts or undigested food. Your body's like, what is that undigested piece of strawberry? I'm going to attack it. This is where food sensitivities, this is why autoimmune disorders actually begin in the gut. There's a lot of this situation happening. And then if there's inflammation in the gut, you have all these cool things floating around. These gap junctions, which normally allows particles to flow through, they get wide, they get holy, they get leaky. So these complexes then go out into the systemic circulation and can deposit on the brain. This is This is the neurologic ADD, ADHD, dyslexia, dyspraxia, Alzheimer's, all the inflammatory neurologic stuff. Look here first. On the sinuses, chronic sinusitis. On the lungs, asthma, recurrent asthma, chronic asthma, bronchitis. On the joints, arthritis, itis. And it doesn't have to be like a typical GI symptom. People think that you're not bloated and full, don't have diarrhea and constipation, that this isn't going on. That's not always the case.
We'll go through kind of how we, after speaking to people, getting the history, the test that we use to assess from the cardiometrics through serum labs, as well as the Dutch test, which is fully shown us hormones and adrenals. It's like a urine test, looking at metabolites, which is really nice. See that. And on GI effects, which is going to get some really nice focus on what's going on with gut health. 5 core areas, from digestion to inflammation to beneficial bacteria and metabolic health, like I said, an infection.
So a lot of our treatment plan is holistic in the way that we talk about nutrition, targeted supplementation, movement, addressing stress, your lifestyle, and spirituality. So this is kind of that high thing that we were talking about. Everything matters. And it's interesting to look like maybe I'm really good at my nutrition, but my movement needs some work, or I have a lot of stress in my life. My relationships are great. It's almost like a wheel, like spokes on a wheel, like you could even measure. So these are kinds of nutrition, kind of a nutrition. Of course, it depends on how the patient presents, what the tests show, what symptoms they have, or what they want to work on. But we primarily encourage the Mediterranean style diet, plant slant, healthy fats and proteins and carbs, clean protein, lean animal protein, good fats and oils, high in omega-3 fatty acids, high fiber, good carbs. We did have a patient who is a university professor. She did this and she said, I don't get hangry anymore. And when I grade my papers, I'm so much nicer. I'm like, well, that's really great for your students. And it's also where you are, like for adrenally fatigued people, we don't push them to exercise. Maybe more rest, restorative yoga, Pilates. These are down-regulating. It helps down-regulate the nervous system. I love also like fascia stretching, because the fascia, which is the covering of the muscle, like we had a chicken and it's that white kind of layer over the top. But what we're seeing in the research now, this is the place where pain is held, inflammation is held, stress is held. So the 3 things that make fascia tight. I mean, it's viscoelastic. So, there's some quality of viscosity, fluidity. And if we're sitting all the time, we're dehydrated and we're stressed out, our fascia does not, right? And so I'm a big Pilates advocate, yoga advocate just for that. And then stress management, anything that, somebody was like, well, how do I meditate? Do I have to meditate? I mean, we have this thing where we're a good meditator if we sit on the yoga mat or on our cute yoga pillow for 20 minutes and it's really quiet. Obviously, who invented that does not have children, does not work, or have a job, right? So, I mean, for me, it's meditation it's when you start to connect to yourself and something higher, being still and mindful. You are meditating when you look at the sunrise. You're meditating when you pet your dog, meditating when you hold your baby, grandbaby. Those are all moments of meditation, right? So you can define that for yourself, but it is a lot about this rest and downregulation of the nervous system. So we're not always running in fight or flight. There's no way, most of us are sprinting in there. Main reason why we're drawn to nature is because our natural rhythm is that of nature. And our neuroendocrine system hasn't been able to keep up with this lifestyle. There's just no way.
Thank you for listening to this episode of the Soul of Medicine podcast, where science meets soul for whole health healing. Are you ready to reclaim your energy, vitality, and soul purpose? Then feel free to head to our website at kcorpusmd.com and schedule an appointment for your root cause review.